There are some common problems that you need to know about associated with bowel elimination. The first one that you're probably most familiar with is called constipation. Constipation is a frequent problem, particularly with the elderly in our society. And constipation is simply the passage with difficulty of very hard, dry stool. This occurs when the stool passes through the intestinal tract slowly and more water is absorbed by the body into the bloodstream, and as a result becomes more and more hard. Some contributing causes to constipation are patients that have an inadequate fluid intake, patients that have an inadequate intake of fiber or roughage foods in their diet, people who have an inadequate physical activity, people where there is lack of privacy for elimination. For example, nursing home residents may have a roommate. There's a lot of other people walking around. It can be a cause of problems with constipation because the patient is uncomfortable having elimination in the presence of so many others. Some medications can also be a contributing cause to constipation. For example, vitamins that contain iron predispose a person to constipation. Another common problem with bowel elimination, not as common certainly as constipation, but can occur, and that's called a fecal impaction. If a constipation is not removed quickly enough, it can develop into a fecal impaction. This is where the stool remains in the intestine and rectum for a prolonged period of time, getting it more and more dehydrated or lacking in water and becoming harder. The patient is unable to pass the stool any longer, and it forms a blockage in the lower intestinal tract. Usually, however, there is a small amount of liquid stool that can get around that fecal impaction, that blockage, and is often a sign that the person does have a fecal impaction. There are some other signs and symptoms of this problem that you need to be aware of. First of all, anybody who has an absence of a normal stool for 3 or more days, you might suspect might have a fecal impaction. Another sign might be a person who has just small smears of stool on a toilet tissue, for example, and not a normal bowel movement. Person might have abdominal discomfort, or nausea and even vomiting might be a sign of a fecal impaction. The person might be experiencing rectal pain, or they might have a lack of appetite. With any of these signs and symptoms, please notify the nurse so that the impaction can be relieved as quickly as possible. Another problem that can occur with bowel elimination is diarrhea. Diarrhea is a frequent passage of very soft or liquid stool. This is because the stool moves through the intestinal system more quickly than it should, reducing the time for absorption of water into the bloodstream. Diarrhea can cause dehydration. Dehydration is a lack of adequate fluid in the body, and dehydration is a particular problem for the very young and the very old, and can be a deadly problem if not corrected. Report any incidents of diarrhea immediately to the nurse, and provide really excellent pericare after any episode of diarrhea that your patient might have, since diarrhea left on the skin can cause a lot of irritation and skin breakdown. Another problem with bowel elimination is gas or air that's retained in the intestinal tract. This is known as flatus. It causes the intestines to stretch and distend. Most gases that form in the intestines are absorbed into the bloodstream. However, when a person consumes a lot of irritating and gas-forming foods and beverages, flatus may increase and cause abdominal cramping and distension. When there is muscular contractions that are slowed dramatically, flatus can become a very severe problem. An example that comes to mind might be a person who's had abdominal surgery. Frequently, when people have had abdominal surgery, there's quite a bit of movement and manipulation of the intestines, and that causes them to be irritated, and following surgery, they frequently will have difficulty with gas forming because the flatus is not being absorbed into the bloodstream. There are quite a number of ways in which you can assist with bowel elimination. The first and probably the most important one is to provide respect and dignity when assisting any patient with bowel elimination. We need to accept bowel elimination as a normal function of life. Making any kind of facial expressions that are negative in nature or any comments, negative comments, only serves to increase patients' embarrassment and should never occur. Another is answer the call light promptly. Patients should not prolong or ignore the urge to defecate, as it will increase the likelihood of constipation occurring. Encourage bowel elimination on a regular schedule. Most people have a certain time of day when they have a bowel movement. For many of us in our society, this is shortly after breakfast. It's important for you to know your patient's bowel habits and not schedule activities, for example, bathing procedure, during that time. Another way that you can assist in bowel elimination is to be sure to allow for sufficient time for the person to evacuate their bowels. Do not rush them. Provide for privacy as well. In our society, bowel elimination tends to be a very private matter. Allow the patients to use the bathroom with the door closed but not locked if it's safe for you to do so. For patients that are confined to bed, the curtain needs to be pulled around them or the door to the room closed so that the privacy is enhanced